Good morning, student. Hope you all are well. Myself, Irina, your health coordinator from Amrit INDO Canadian Academy. From the picture, you can easily assess that what we are going to study. Today, we are going to study about first aid. What do you mean by first aid? Temporary treatment, immediate treatment, emergency treatment completes the definition of first aid that it is a temporary and immediate treatment given to a person who is injured or suddenly become ill by using facilities or materials available at that time so that we can save the life of a patient before regular medical help comes. Here are the objectives. First is to preserve the life. It means that we have to save the life of a person for the future. To prevent further injuries means while lifting or shifting, we should handle the injured person very carefully so that we do not give any further injuries to the patient. To conserve strength means one have to preserve the strength of the patient by calming the patient. Provide earliest medical care. A first aider should assess that what are the things needed that a first aider see that what a injured person need, like if the patient is bleeding badly. Most important is to stop the bleeding first. First aider. Who is this first aider? First aider is just a common person who may have learned a standard method of application of first aid best suited to his skill. He is trained to reach patient, identify the problem, provide emergency care, and when necessary, move the patient to the hospital without causing further injury. Here are the qualities. First is the observer. One should be a good observer. It helps to know that what is the first thing a person has to do for giving care to a person. Act quickly in this after observing the situation and condition. One should not waste the time and quickly start doing the work for the patient. Panky. The first aider should not be panky. After watching the patient who is badly bleeding or unconscious, one should not panic or get excited. Confidence. First aider should always be having self-confidence that he can do anything with the proper skill and can save the life of a person. Judge. First aider should be a good judge. By judging the patient, one can easily understand the condition of the patient. Reassure. It plays a very important part. The first aider should reassure the patient and the relatives that he or she is doing her best to save the life of a patient. Crowd control. Number of time at the accident site. Lot of crowd gathered around, which leads to delay in your work and it may create anxiety in the injured person. For safe and skilled work process, one should remove the crowd first so that you can do your work quietly and quickly. Responsibilities. Easiest and safest way means one's approach to the casualty should be easiest and safest. Observe and assess the situation. While observing only we can understand the situation of the patient. Call to ambulance and police. Immediately call to police at 100 number and ambulance at 108 to reach the accident site. Turn off. If the engine of the car or any vehicle is running, immediately turn off the engine to control any further accident. Check for unconscious, conscious, alive or dead. By observing the person, one can easily understand the condition of the person. Like that, we can identify the condition of the patient only by observation. Immediate treatment. If any immediate treatment is required, do the work quickly and quietly. Arrange for shifting. As soon as possible, shift the patient to the hospital to control the deterioration of patient's health. Keep the record. Before shifting the patient, one should keep the record of the patient such as site of accident, time of accident, injuries and witnesses to protect oneself from the law. Now here comes the end of the responsibility of the first aider. One's responsibility ends when the patient is shifted to the hospital in the safe hands of the doctors and nurses. Here are the warnings to the first aider. He or she is not a doctor. One should not say anything to the patient or relative as he or she is not a doctor. Do not open the wound. One can easily give more infection to the patient while opening the wounds. Do not declare any person as dead as you are not a doctor, so you are not allowed to declare a person as dead. Here are the golden rules of first aid. First thing first, understand the situation and do the first thing first according to the need. Artificial respiration. If the patient is not breathing but heart is working, immediately provide artificial breathing such as mouth to mouth breathing. Stop the bleeding by giving pressure on the bleeding side with the help of gauze pads. Treat shock by lifting the patient leg upward and giving support to them. We can treat the shock. Reassure. Approach towards the relative and the patient should be sympathetic. Do not remove clothes. A person never feels good if the clothes are removed in front of anybody. So to avoid removing clothes unnecessary. Remove the crowd. To reduce the anxiety of the patient and for smooth working environment, we should always remove the crowd. Send to hospital. Immediately shift the patient to the hospital. Inform relatives. If the patient is alone, we should immediately inform the relatives of the patient. Here is the first aid kit which should contain a roller bandage, adhesive tape, gauze packs, scissors, betadine ointment, Savlon solution and band-aid to cover the wound. Now come the recapitulation of the topic. First was the definition, objectives, first aider, qualities, responsibilities, end of the responsibilities, warning to the first aider, golden rules, first aid kit. According to Bobby Sherman, take some time to learn first aid and CPR. It saves life and it works. Thank you.